When you're feeling ill, one of the most stressful feelings is that not only do you possibly have to go to the hospital, but that the tests you may need to undergo once you're there could be expensive, invasive, and even dangerous. Well, one Israeli company focused primarily on various cancers is working to solve some of these issues. Joining me in the studio now is President and COO of Nucleix, Dr. Opher Shapira, to tell us more about his non-invasive and revolutionary diagnostic tests. Thank you so much for joining me.
Thank you.
All right, so first of all, let's just get right into it. I understand that Nucleix has submitted 5 patents already, so how do your products work? Tell me about some of them.
Well, our products, the company itself mainly focus on non-invasive cancer detection. We work in something that's called epigenetics. In general, what we're doing, we're looking along the DNA for places that undergo changes between normal and cancerous tissues, and we build tests based on these locations in the DNA. So we take liquid from the body, either urine for our bladder test or blood for our lung cancer application, and we apply our markers, which is this location in the DNA that undergo changes, and we analyze them, and based on it, we decide whether this is DNA coming from a cancerous tissue or a normal tissue.
So of your patents, I understand that you have one product that is already out, or at least has been released in the bladder EpiCheck.
Exactly.
All right, so tell me about that. When and where will it be available? What does it do?
Well, bladder EpiCheck is a test that is aimed to monitor patients that had bladder cancer, and this disease is highly recurrent. So we're looking for those patients to see if there's a recurrence of the disease. So it's aimed for patients that are monitored for recurrence, and we just received the CE mark, meaning that we can market this test in Europe. We just received it about 10 days ago, so we start selling in Europe. Yeah, thank you very much. So this is now going to be available in Europe. Actually, our salesperson is now traveling in Spain and in Netherlands trying to close deals. And this test, as I said, is for monitoring patients for recurrence of the disease. It's not for early diagnosis.
So, okay, so then my question is now, you have this technology that looks for certain markers that can differentiate, that can basically find what's different in this picture.
Right.
So does it work with any other diseases, or it's really targeted very specifically at cancer?
In principle, it can work with all types of disease or cancers that we think, but you have to attack them one by one. So we started with the bladder cancer. This is a urine-based test. Then we went to the number one cancer, which is the lung cancer. Lung cancer is the most prevalent in most of the countries and certainly most deadly one. So we build the test based on blood samples. Now, once we finish with the lung cancer, we'll continue others, because what the company has is mainly an engine to develop such tests. Give us enough normal samples and 6 samples, and we'll develop markers based on it and develop a test for that.
So, how did you get into this? This is a very specific field, it sounds like. What inspired this specific focus on cancer and this technology?
Well, the company was founded by 2 scientists that came out of the Weizmann Institute, and 2 bright guys, Dr. Wasserstrom and Dr. Frumkin. And they came up with this idea of identify those changes in the DNA. And they started it. They actually started a long time ago and thinking about forensic medicine, and then they came up for cancer. Because cancer, of course, the need is huge in the market. There's a big need for cancer detection. Secondly, cancer lends itself well to this type of testing, because cancer starts with changes in the DNA. Those changes are exactly the one that we are detecting. So we start focusing on that. We looked at the first one on the bladder cancer, thinking this is a real need in the market, and it's relatively lower hurdles to jump on to get to a test. Then we went to the tougher one, which is a lung cancer, because you take it from the blood, there's less DNA coming from the tumor in the blood. So we went to this, and now we have wonderful result on the lung as well. It's still in our lab. It's not yet out in the market, but we're getting there.
Well, again, I'd love to congratulate you on your progress so far and the coming out of the EpiCheck. And I really can't wait to see the other 4 products as they come out. Thank you so much for joining me.
Thank you very much for having me.